I'm Bernie Rosof, Chair of the Roundtable on Health Literacy of the National Academy of Science, Engineering, and Medicine. I want to welcome everybody to today's meeting. I'm sure everybody's going to find the agenda quite interesting, informative, and exciting, to say the least. I also want to everyone know that this meeting is being recorded and videotaped for webcast across the internet. With that said, I do want to say that the nor'easter that came up to the northeast, which is where nor'easters go, really changed some of our plans here today. A number of the roundtable members could not make it and could not get out of the airport. And so we were devoid of some of the staff, but I must say Lila was up to the task. She did the work of three, so nobody's going to notice that we're devoid of staff. We do have Lila's daughter, Tresney, here, and Tresney will satisfy a lot of what others could do until they get here. In addition, these name tags do not stay on. Don't worry about it. They'll fall off, but we all know who everybody is. And by the way, coffee is also delayed. I don't think it came from the northeast, but it's delayed, and it should be here by 10 o'clock. And we will enjoy the coffee when it comes. So the mission of the Roundtable on Health Literacy is to inform, to inspire, and to activate a wide variety of stakeholders to develop, implement, and share evidence-based health literacy practices and policies, with the goal of improving the health and well-being of all people and actually improving the health and well-being of our nation. As one of its major activities, the Roundtable sponsors workshops for members and the public, and we always welcome the public, to discuss issues of importance and concern, such as the focus of today's workshop, facilitating health communication with immigrant, refugee, and migrant populations through the use of health-literate approaches. And obviously, this topic has been in the forebrain of most of us for the past year, at least, not the fact that it wasn't there before. Certainly, the 10 attributes of health-literate healthcare organizations, as in the National Academies discussion paper of June 2012, has applicability here and to our meeting this morning. Briefly, they are, let me just go through it briefly, I think it'll be helpful. They are integrating health literacy into leadership, mission, structure, and operations, planning patient safety and QI, preparing the workforce to be health literate and monitor that progress, including community members in the development and design of information and services, meeting the needs of populations with a range of health literacy skills while avoiding stigmatization, important as we will hear, providing easy access to health information services and navigation assistance, designs and distributes print, audiovisual, and social media content that is easy to understand and act on, and it communicates clearly with health plans and what individuals will have to pay for services. It is clear that language and communication affect all stages of healthcare access, and that's the focus of our roundtable at all times. The increasingly diverse ethnic composition of the United States population has placed the nation in the midst of a really profound demographic shift, which will continue. And public health and healthcare organizations face many challenges as they move to address and adapt to this change. In addition, there is tremendous uncertainty about what the future holds for our strong, vibrant, multicultural country. Many are worried, many are afraid, and that makes it even more difficult and vital to provide needed public health services. I can't emphasize that too much. Data from the National Minority Quality Forum supports the demographic shift, identifying specific